All right, let's talk about prescribing. But we're going to go way beyond the textbook today. This isn't just about pharmacology. We're diving into the real-world art of prescribing, how you do it safely, how you do it effectively, and most importantly, how you do it as a team with your patient. So let's jump right in.
Okay, this right here, this is the single most important idea to get in your head. Prescribing is not something you do to a patient. It's something you do with them. You know how the plane works, sure, but they know where they want to go. You are their co-pilot. This whole idea of shared decision-making, it's the foundation for literally everything else we're about to cover. So let's start with the absolute non-negotiables. Think of these as your core commandments, your personal never events that really are the bedrock of safe practice. If you get these right every single time, you've already built a really solid foundation.
Now, this isn't just, good practice. It is a medico-legal requirement. I'm going to say that again. Every single time you prescribe, you have to document that you talked about the pros, the cons, and that the patient agreed. It protects you, of course, but way more importantly, it makes sure the patient is a genuine partner in their own care.
This one might seem so small, but trust me, it is a classic fatal error. Writing MCG can so easily be misread as MG, and just like that, you've got a 1,000-fold overdose. It is a catastrophic mistake that comes from just 2 little letters. So the takeaway? Always write it out in full, no exceptions.
Think of a prescription pad, especially one for controlled drugs, like it's a book of blank checks. Seriously. Leaving it lying around is a massive security risk. It's just an open door for forgery and for powerful drugs like opioids to get diverted out into the community. So lock them up. Keep them secure. A complicated drug regimen written on a piece of paper, it can be completely overwhelming for anyone. To make sure your patient really, truly gets it, you have to go beyond just words. Use visual aids, draw simple diagrams, maybe get a pill box involved. The goal here isn't just to spit out instructions, it's to make sure there's genuine understanding. Okay, this one's a bit more technical, but it is so important. Biologicals, they're these complex proteins, not simple chemicals like, say, aspirin. They have to be prescribed by their specific brand name. Why? Well, it ensures the drug is binding to the exact right target in the body, and it allows for perfect traceability if, heaven forbid, something goes wrong. All right, so we've hammered home the hard rules of safety. Now let's move on to something a little more nuanced, the actual skill of communication. This is where the magic happens. This is how you build the trust that is absolutely critical for any treatment to actually work. Just explaining the why behind a prescription can totally change the game. Take an SSRI, for example. You could say something like, okay, so this medicine works by slowly changing the balance of a chemical in your brain called serotonin. The thing is, it takes about 2 to 4 weeks to really build up, so you might not feel better right away. In fact, some people feel a little more anxious at first. That's totally normal, and it's actually a sign the medicine is starting to do its job. You see? That little explanation can be the difference between success and failure. Here is a classic real-world dilemma you will face. A pregnant patient is worried about labetalol's effect on her baby. First, you validate that concern, but then you frame the choice. The potential risk of the drug has to be weighed against the very high, very real, and very immediate risk of not treating her high blood pressure, which is maternal eclampsia. A lot of the time, the biggest danger is actually doing nothing. And you know what? When you're having those high-stakes conversations, you don't have to rely on ward myths or something you vaguely remember from a lecture. You have tools. UKTIS is an incredible resource. It gives you actual, evidence-based data on drug safety in pregnancy. It empowers both you and your patient to make decisions based on facts, not on fear. The big takeaway here is this. If a patient isn't taking their medicine, your first question should never be, why aren't you listening to me? It should be, what's getting in the way? Is it the cost? Do they have cultural beliefs about it? Is it for a kid who thinks it just tastes gross? You have to approach non-adherence with curiosity and empathy, never with blame. All right, let's talk about one of the most common challenges you will see on any ward, polypharmacy. I'm talking about when a patient has multiple conditions and a medication list as long as your arm. Your focus has to shift from just treating diseases to actually optimizing their quality of life. This right here is your guiding principle. You have to constantly be asking yourself, is this medication helping more than it's hurting? Is the burden of the side effects or the cost or just the complexity of taking it, is that outweighing the benefit? There are tools like the stop/start criteria that can help you make these calls systematically.
Now this is a critical drug interaction you need to have burned into your brain. An ACE inhibitor plus an NSAID, especially in an older patient who might be a bit dehydrated, is a classic recipe for acute kidney injury. It is a combo you need to be able to spot from a mile away and prevent. So when you do decide to deprescribe, you can't just stop everything cold turkey. You have to understand the physiology. Stopping a beta blocker suddenly, that can cause a dangerous rebound surge in blood pressure. And stopping a benzodiazepine too quickly can literally trigger life-threatening seizures. You've always got to taper them off properly. Okay, here's a piece of insider knowledge that really separates the beginners from the experts. A medicine isn't just its active ingredient. The so-called inactive components, the excipients, can cause real harm. For instance, propylene glycol, it's found in some IV drugs, can build up in patients with kidney failure and causes severe metabolic acidosis. You have to look beyond just the drug name. Look, no matter how much you know, you are going to face situations that are just beyond your experience. And knowing when to escalate, when to call for help, that's not a sign of weakness. It is a critical safety skill and the sign of a truly mature clinician. So here's your checklist. These are the red flag situations. If you run into any of these, you do not wait, you do not wonder, you escalate to a senior colleague immediately. This is your patient's final safety net, and it's your job to be the one to activate it. So, we'll end with a little food for thought, a question to get you thinking like a clinician. Based on everything we've just talked about, the mechanisms, the risks, the patient's goals, what's your next move here? This kind of thinking, this is what turns good prescribers into truly great ones.